No hospitals, no antibiotics, no anesthetic, just each other, a fire, and what worked. And some of them survived things that should have killed them. We know this because we found the bones. Skulls with deliberate holes drilled through them, bone regrowth visible around the edges. The patient lived long enough for bone to form again. The oldest confirmed trepanation is around 8,000 years old. Some sites push closer to 12,000, not accidental, surgical. Someone decided to cut through another person's skull. Did it. And the person walked out. At some Neolithic sites, the survival rate was 50 to 90%. Not luck. Skill. Trepanation sites appear on every inhabited continent. Someone everywhere at some point did this. The evidence of survival is consistent across the record. Subscribe if you have ever faced a procedure that frightened you. Whatever it was, it came with anesthetic and sterile conditions. What ancient healers worked with had neither, and people still came through. The bone evidence goes far beyond skull surgery. Skeletons across 3 continents show healed fractures set deliberately. Someone manipulated the bone before it could heal wrong. They reduced the fracture, held it in place, waited for something to knit together. This required days of keeping a person still. Someone stayed to make sure they did not move. Healed amputations show clean cuts rather than trauma patterns. Someone chose to remove the limb, made the cut, kept the patient alive through what followed, through the infection that almost certainly came, through the fever that followed, through the long weeks of recovery. Some in the record survived conditions requiring years of care, people who should not have lasted a season, lasting decades, because someone kept showing up. These are not accidents in the fossil record. These are interventions. Someone knew what to do. The question is always how. Same answer as almost everything in the ancient world. Observation passed across generations. A Paleolithic healer had not read a textbook. They had been watched by someone who watched before them. Plant knowledge was tested by people who did not survive the testing. Bone technique was refined across generations of broken bones. Every failed treatment was information about what not to try again. Every survivor was evidence that something had worked. Medicine began as pattern recognition with no margin for error. Getting it wrong meant someone died. Sometimes that was the person who held the most knowledge. Obsidian blades are sharper than modern surgical steel at the molecular level. Not a myth. Measured and confirmed. Ancient surgeons had the finest cutting tools ever made. The infection risk was catastrophic by modern standards. No germ theory, no sterile technique, but sharp tools, fire, and plant knowledge built across generations. They knew which plants slowed bleeding, which reduced visible swelling, which helped a patient sleep through the worst of it, which signs meant the wound was turning dangerous, what it meant when the fever broke, and what it meant when the fever did not. Survival rates were lower than today. People died who would survive with modern care, but people also survived things they should not have, because someone knew what to do and stayed beside them. Every person was a resource the group could not easily replace. Time spent caring was time away from hunting and gathering. Ancient communities made that calculation and sometimes chose care anyway. Not every time, not for everyone, but often enough to leave a clear mark across the record. Some examples involve people who contributed almost nothing. No practical case for keeping them alive. The group kept them, fed them through long seasons, tended wounds that were slow to heal. There is no clean rational explanation for that, except that someone refused to leave. That impulse is not a modern invention. It is older than organized medicine or philosophy. It began beside a fire, with tools made from stone, and someone who had watched closely enough to know what to do. That knowledge took generations to accumulate. If the person holding it was lost, rebuilding took years. So the group protected them, fed them when they could not feed themselves, carried them when they could not walk, not only out of sentiment, out of understanding that what they knew was worth keeping. And in doing so, they passed something forward, something that eventually became hospitals and surgical training, and the refusal to stop trying. That refusal started beside a fire, with a stone blade, and someone who refused to leave. The people who survived did not survive alone. They survived because someone decided leaving was not an option. That decision was made in the dark, without guarantees, without certainty that anything would work, just the knowledge of what to try next, and the willingness to stay. That is the oldest form of medicine we have. It did not require a hospital. It required knowledge and the decision to stay. Both existed long before any institution did. Both are still what good medicine requires at its core: a healer who knows what to do and refuses to leave. Ancient wound care was not only about the treatment, it was about who stayed through the treatment. Staying was the medicine as much as the plant. The patient who survived did not just survive the injury, they survived the weeks and months after, because someone was there for all of them. That commitment did not require ideology. It required showing up, over and over, until it was done. The knowledge mattered, the plants mattered, the sharp blade mattered, but the staying mattered most of all. The wound that was treated became proof it could be done. Not every patient survived, but enough did to show that intervention was worth attempting. That is how medicine accumulates. One intervention at a time, one patient at a time, one healer watching closely enough to notice what worked, and transmitting that knowledge forward to the next one. The chain of that transmission is unbroken. It runs from the first trepanation to every operating theater today, through every person who learned by watching someone else, and stayed beside the patient until the outcome was clear. That continuity is the oldest fact about medicine. Knowledge plus the decision to stay, both present since the very beginning, both still necessary, both still the most important things in medicine. The patient did not survive the wound alone. They survived the staying, the hours and days of someone refusing to walk away. That refusal is as old as our species. It has not changed, not in any meaningful way. Knowledge plus willingness to stay. That has been medicine from the beginning. It is still medicine now. The tools changed, the knowledge grew, the impulse remained, and it is still what every good treatment depends on. That chain of knowledge and commitment is unbroken. It connects the first healer to every doctor alive today. The medium changed. The transmission continued. That is what medicine actually is. Drop a comment. Is there someone in your life who refused to leave? That impulse is as old as our species. Like, share, subscribe. They had no hospitals. They had people. And sometimes that was enough.